Hi guys, welcome. I'm Scott Thomson, Director of Evolve Pilates and Holistic Health and Physiotherapist. Today we're going to be doing essentially a level 1 class on the EVO MKII Portable Reformer. So let's get started. We're going to start off just using 2 reds and 1 blue spring, and we're going to lie on our backs and just putting our feet up onto the foot bar. If you need the headrest up, if it feels more comfortable for you, you can just flick it up like so, and your hands can just be resting down by your side or onto your tummies. Okay, so we're going to just start off just relaxing the shoulders, rest them onto the carriage, and what I want you to do is just feel your ribs and just feel them just compressing into the carriage there, and also your tailbone just compressing into the carriage. We're just going to push up with your feet on your heels just to about 90 degrees. And from there, I want you just to have a little practice of tilting your pelvis. So what we're going to do, first of all, is we're just going to identify some landmarks, and we're going to find just a little bony prominence in your hips. Okay, and we'll put our pinky fingers on that, and we're going to identify just the very base of our ribs directly above that. Okay, once you find those 2 little markers there, I want you to do what's called a pelvic tilt. So if you tilt your pelvis forward, what will happen is you'll find your back arches away from the carriage, and if you tilt your pelvis back, you find your back arches towards the carriage. Okay, so if I do an anterior tilt, pelvis arches up, and a posterior tilt, pelvis arches back, or the lower back compresses into the carriage. Okay, so what I want everyone to do is just do a little bit of a posterior tilt, just so you can feel your lower back just compressing slightly into the carriage there. And if your feet just about hip distance apart, heels on the bar, you can push away, and then we're going to come back down to about 90 degrees there. And we're just going to continue with that. So we're going to breathe in, and we're going to breathe out. And when we're breathing in, just remembering we're breathing in through the rib cage, and breathing out, just a relaxed expiration. You might also want to think of your abdominal area here now. You just put your hands on your tummy. As you breathe in, let your rib cage expand as you breathe out, just making sure that you're just gently pulling your tummy down against your spine. So continue here for a few more. Breathing in and breathing out, and breathing in and breathing out. Good, we're just going to push up to about 90 degrees there again. We're going to tabletop one leg this time. So what that means is the knee is just going to come directly over the hip joint. We're going to make sure that we haven't tensed through our abdominal muscles too much there, so we're not pushing out and bracing through our abdominals, just the belly just staying relatively relaxed or drawn back in against the spine, and we're going to continue there. So just driving up and coming back down. So pressing up through the heel, and when you come down, if you look down through your feet, your knee should be just tracking round about over that second toe. And then we know that your hips are also going to be in the right place. If you want to add a bit of razzle dazzle, as we bend down, we're just going to stretch the left leg out over the bar. As you come back, you're going to bring that knee back over the hip. So just continuing there. Good. We'll do a few more reps on this side. Keeping that breath flowing. And one more. Very nice. So we'll change over feet. We'll put the left foot down, bring the right foot up. So this is a great exercise for just strengthening the muscles through the hamstrings, quadriceps, and into the glutes there. So again, making sure just that knee is tracking over around about that second toe. And when you're ready, extending the leg that's up over the bar. As you push back, bringing it back over the hip. Just again, being mindful, you're not bracing through your tummy, and keeping that gentle pressure, that gentle posterior tilt and pressure into the carriage. We'll do a couple more. Good, and one more. Okay, fantastic. Putting both feet back onto the bar. we're going to bring the feet just as wide as you can bring them onto the foot bar, and we're going to go into a bit of hip external rotation. That's also, we can call that turnout. So we're going to just rotate out through our hip joints, and we should have the effect of the toes rolling out and the heels rotating in. Okay, and from that position there, again, making sure that we're folding through the hip joints and not moving the pelvis. We're going to bend in and pushing back out. Your feet are now rotated out to about 45 degrees. So as you bend in, again, making sure your knees are tracking just round about over the second toe of each foot there. And that will keep you just in that same amount of hip external rotation. Good. And controlling the carriage in both directions. So controlling on the way in and pushing on the way out. So nice little sort of gentle hip opener also as well. If you are getting hip impingement symptoms and you are feeling that your hips are sore during this exercise, you might want to just lessen the amount of external rotation going through your hips. So we'll continue there with that breath flowing again. Breathing in, and breathing out, and one more breathing in, and breathing out. Fantastic. So to finish up with the leg and footwork there, we're going to put our feet onto the bar, and we're going to put the balls of our feet directly on the bar here now. Okay, and what we're going to do is just a little heel raise. So we're going to drop just both heels down, and then we're going to push them back up, like coming onto your tiptoes. In ballet, they would call that Demi Point. So we're going to just rise back up again and bringing the heels down. Try and keep most of the weight through the first two toes, the first two metatarsals, maybe about 70%, and the other 30% through the other parts of your foot. So rising up and coming down, breathing in and breathing out. You're going to feel this quite strongly through your calves. Good. Let's go one more. And controlling in both directions. So on the way down, we call that the eccentric contraction. On the way up, we call that the concentric contraction. Important to control both directions. Okay, and then from there, we're going to go into what's called walking. So walking, what we're going to do is drop one heel down and bend one knee. And with the foot, the heel that's down, we're going to push that up. We're going to transfer a little bit of the weight over to the left heel, or the left foot, sorry, and we're going to control that on the way down. So driving up with the left foot, lowering down with the right. Driving up with the right, lowering down with the left. And we're just going to continue that. And as you feel more comfortable with it, just gaining a little bit of a rhythm there. And just keep your breath flowing. Good, and we'll do a few more there. Again, just being mindful of what's going on around your hips and pelvis. Just controlling your core, relaxing your shoulders. Good, and one more. Okay, nice. We're going to come down there. Okay, and we'll just come up into sitting there. And we're going to do what's called the knee stretch now. And so for the knee stretch, I might just change over the spring. So we might just go onto one red and one blue. And we're going to kneel into the carriage, just like this here. So we want your arms just to about 45 degrees to the horizontal. And just push back so your body's about 90 degrees to your arm. Okay, here we're just going to breathe in. As we breathe out, just draw your tummy up against your belly. Okay, and from this position here now, what we're going to do is make sure that the knees are directly under the hips. And we're going to keep the shoulders just gently down away from the ears. And we're going to externally rotate through your hands a little bit. So in other words, it's like you're bringing your palms in towards each other. And just so your elbows are just going to point down a little bit. And from here, we're just going to push back with our knees and let the knees come back in again. So it's very important here that we're just remaining stable through our pelvis. We're remaining stable through our spine and also through our thoracic area of our spine and our shoulders. And where you're actually folding is again just below that little bony prominence there on your hip, and you're making sure that you're just folding into the hip joints. Okay, so I'll show you what would be considered to be a bad technique, is when you're bringing your knees in and you're collapsing through your spine, and as you're pushing out, arching through your back, like so. So again, try and get nice and stable through your pelvis and hips, okay? Drawing your belly in, finding that nice neutral spine, and just gently pushing away. So it's quite a subtle exercise, but you will certainly feel it if you're not used to it. Good. And we'll go a few more there. And one more. Okay, we'll keep on the same springs. We're going to go straight into what's called an overhead press. So from here, I'm going to get you to push all the way back. And we're going to just drop our chest down through our hands. Okay, and we want to keep, again, the knee just stacked directly over your hips. And from here, what we're going to do is just, again, draw your belly up against your spine. And we're going to allow the elbows to bend in, staying stable through the spine, and then push your hands away. So again, it's important, I'm naturally keeping my elbows turned down here, so I'm keeping a little bit of that rotation force through the hands. So my elbows are pointing down, drawing my belly in, staying stable through my hips, my pelvis, and my spine, and pushing away. So coming down, and we'll breathe in as we push away here, and we'll breathe out as we come back down. So let's just do a few more here. You'll feel this quite strongly through your triceps and also around that scapulothoracic area. Good. And let's go one more. Very good. And we're going to come back in just there. Okay, next exercise we're going to do is called an up stretch. And this is going to put a bit of a gentle extension force through our spine. So you put the hands onto the foot bar again, and you're going to drop your hips forwards. And what you can do here is give your glutes, activate your glutes a little bit, and that will just protect your lower back. Keep your shoulders down away from your ears, and just gently what we're doing is just going to bring the chest up and out. I often tell clients or people doing my classes, if they imagine they just have a little hook into the sternum there, and someone's just gently pulling them up and over, keeping the chin down, so not compressing into the back of the neck there at all. And just breathing in and breathing out. Keep your tummy pulled back against your spine also as well. And we'll do a couple more. And one more. Very good, and just bringing the reformer back down. Okay, so the next exercise we're going to do is called the scooter. Now, before we do this, if you're not used to this exercise, we're just going to do a little tutorial on just how to squat and bend. So, and using a sort of a safer and Pilates technique. So what we're going to do here is you're going to find again your ASIS, which is your anterior superior iliac spine on your pelvis. So the two most bony prominence is quite easy to find generally. And once you get that, again, put your pinky fingers on it, and just directly above that, bring your thumbs onto your ribs. Hands onto your belly there. And what we're going to do from there is going to take a big breath in. And as you breathe out, just bring your belly back against your spine. Through your feet, I want you to almost imagine that they put them directly underneath your hips there. And we're going to put a little bit of a rotational force through your feet. So like you're bringing your heels in towards each other and your toes away, and it's going to just turn your knees out slightly, just like so. You might feel your glutes squeeze on, and also the muscles in your groin switch on as well. What we're going to do now is we're going to keep this distance from the ribs to the pelvis anchored, so it's going to stay the same distance apart, and we're going to fold just exactly from under our pinky fingers at the hip crease, like so. Keeping the chin down and then coming back up. So the knees are staying pointing out over that second toe. We're going to try that one more time. So going down and pushing back up through your heels. I'm going to show you that from side on so you understand that my knees aren't going in front of my heels. So we'll do it again. So again, keeping this anchored, hinging at the hips, and driving back up through the heels. So do one more of the good technique and I'll show you where you might be going wrong next. Good. So what I mean by keeping the pelvis anchored to the ribs is when you come down, I don't want you to collapse and close that distance down. You see my back immediately flattened there. So we want to try to avoid that. And at the same time, we don't want to just imagine trying to keep your body vertical the whole way down and start bringing the ribs away and arching the back, because then we're probably compressing too heavily into the spine there. So we're just keeping it nice and connected and folding and driving back up. Second place where people go really wrong is with their knees. So people are very used to using their quadriceps when they squat. So what they do is they'll initiate the movement by bending their knees forward, and that tends to load up the lateral quadriceps and also into the ankle joint as well. So what we're going to do instead is we're just going to keep the knees where they are and really practice folding and hinging. It's a little bit harder than it looks. It might take some time to practice that. But with the scooter, it's actually we do it on a single leg. So we're going to just change the resistance bands over. We're going to make sure we're using one resistance band, and you're going to make sure it's on the same side that you're working from. It's very important with the EVO MKII that you make sure that when you do the scooter, you use a red band on the same side as the one you're working from. So we're going to stand with one foot just roughly towards the front of the carriage and the back foot just onto the shoulder bolster there. Grab those little landmarks again. And we're going to go back into a single leg squat. Most of the weight's through the left leg here, okay? And you're going to hinge back, again anchoring down, and maybe from this position here, or you can leave your hands here for the first set, just driving back with the right leg. So breathing in, and breathing out, and breathing in, and breathing out. Where you're actually going to feel this is really through the stabilizing leg. Because you're sitting back in that nice squat there using that good form, you're really going to feel this through your glutes, and especially the glute muscles just on the outside of the leg there. Maybe a little bit down into the hamstring also as well. Just make sure your knees not coming forward too far. Again, we're just going to do a few more repetitions. You should be able to see the whole of your foot, breathing in and out and in and out, and just coming up nice and easy there. So we're going to come around to the other side, and we're going to put the same thing again. Right foot down, left foot back this time, and we're going to fold and hinge on the way down. This time you might just bring your hands behind your back, keep your shoulders down, hold that position there. Very important, I almost forgot. For us, we have to change over the spring or the resistance band there. So we have the resistance band on the scooter doing the same side. Okay, so once again, from here, folding back, good, hands behind your lower back, and again, stretching out. So the reason why it's important to use the resistance band on the same side is the carriage can derail. It's not a big deal, it's very easy to put the carriage back on, but if we're using the resistance band on the wrong side, it just puts a bit of a torque force through the carriage. It's good, so continuing there, keeping your core drawn on, engaging through this glute muscle. This is where you should be feeling it. It's quite a strong exercise. As you get better, you might be able to go and use a blue and a red, but for right now, we're working on the technique a little bit more. Good, and one more. Good, and coming out of that nice and easy. Very good. Okay, so we worked our lower limb a little bit there. We're going to move on to our upper limb now. And we're going to go just onto 2 blue resistance bands there. And we have our straps right now just set around about at the shoulder rest level. That's pretty good for when you're working facing away from the foot bar, and the straps or the ropes are direct in the cam cleat device there, and you'll find that you just test and make sure that that's nice and locked in on both sides. So it's always very important to make sure that's locked in. Okay, so what we're going to do is with the knees probably back a couple of inches or a few inches away from the shoulder rest, we're going to do initially what's called the chariot pull. So we're going to just set from the ground up. So we're gonna, with our knees down there, maybe putting a bit of a rotational force through the legs. So hips, again, turning out, switch the glutes on, breathing in. As you breathe out, draw your belly back against your spine. Okay, and then what we're gonna do is just pull yourself up a little bit here and bring your shoulder blades back and your chin relatively down. So you're gonna pull back evenly through the straps with your hands open. And here it's very important, keep the tension into your hands, okay, as you change the direction. So breathing in and breathing out. And we're keeping the shoulder blades just engaged the whole time. And we're also keeping our hands open so we're not gripping down and unnecessarily using the muscles around our wrists and our forearm. Good, so breathing in and breathing out. Now if you're not used to this exercise, at that moment when you change direction and you don't control through your hands, you might feel a force that makes you fall forwards. If that happens, don't worry too much, as long as you didn't face plant too heavily into your floor, but just be very careful with that. But what you'll find is your body will self-correct that motion quite easily, and you'll start engaging those deeper spinal muscles and stabilizing muscles, which is kind of the beauty with Pilates, is a lot of the muscles that you're using, okay, are turning on sort of subconsciously or subcortically. So your body tends to work it out once you get the movement moving nice and smoothly. Good, we'll do a couple more, breathing in and breathing out, and one more, breathing in and breathing out. We're just gonna cross the straps over now. And we're gonna do a nice little row motion here. So with your hands just down, about the same line as the ropes, we're gonna pull back so your elbows just come to about shoulders height. Again, staying nice and stable through your spine. Your chin down, shoulder blades back, chest out, breathing in through the ribs and breathing out as you go back. So breathing in and breathing out and breathing in and out. We've got two more, breathing in and out and breathing in and out. Okay, we're going to do what's called external rotation now. This is really healthy for your shoulders. This will work what's called your rotator cuff tendons. And we're going to start with the elbows in by your side. We'll keep the straps crossed over. Okay, chest up and out. And what you're going to do is like you're pulling just the straps away from each other and then just coming back. So breathing in, pulling them away, and coming back, breathing out. Now, if you haven't really done much rotator cuff work before, that might be a little bit strong for you. So if it is, just sitting back, and we'll just put yourself down to maybe one blue, and giving that a little go there again. So elbows in by your side, chest up and out, elbows at 90 degrees, core switched on, and just pulling your hands apart, and then just coming slowly back down and then again. So breathing in and breathing out, breathing in, out, and breathing in and out. So these muscles are very important for shoulder stability, and we don't often get to work them out as much as we should. And probably the healthiest thing you're going to do for your shoulders today, no doubt. Good. And we'll go one more. Okay, fantastic. So we're going to turn around now. So what we're going to do here, first of all, I'm just going to make sure probably I'm on back to go to 2 blue again. And we're going to lengthen the straps here. So you just lift the rope up from the cam cleat, you stretch it through. For me, depends on your height here, the length of your arms, but I'm going to bring it to where about this distance here. And you're going to lock that back down, just making sure the other rope is around about the same. Okay, you can check the lengths. And again, you can just make sure that that is very much so in the cleat device. Make sure your headrest is down here. Okay, and with care, you're going to turn around, put your feet back in between shoulder bolsters here, and we're going to bring your hands down by your side. So we're going to come into a high kneeling position here. So from here, just coming up, bringing your hands down by your side, and we're going to come into a bicep curl and back. Okay, so again, just all those reminders, switching your glutes on, switching your core on, elbows down by your side is very important here. hands open, and we're gonna breathe in, bending the arms to 90 degrees and breathing out. Just keeping that chin up, tucked back a little bit, chest up and out, breathing in. So working from that place of stability. So here we're being stable again through our pelvis and our spine and our scapulothoracic area, or the shoulder area and neck area. Let's do a few more there. Good, and one more. Okay, very good. Now what we're gonna do is come up to 90 degrees. We're gonna hold this here and do what's called the offering. So we're gonna breathe in, bring the hands directly out. And we're gonna breathe out, bring them back. So only coming back to about 90 degrees there. So breathing in and breathing out. So just making sure that your elbows don't come back further in this case, especially we don't want to internally rotate our shoulders or collapse them down like that. So keep the shoulders just set back and breathing in and breathing out. A lot of movements in Pilates are quite subtle, and sometimes we're not very good with subtle, so just being very mindful when you're doing these exercises, trying to keep as good form as you can, and generally you improve with more practice. Good, and one more. Okay, and we're going to do the overhead row now. So from here we're going to go all the way up, around with the hands. Don't let them come back behind your shoulders. When you get to about this kind of crucifix position, start bending your elbows back down again. So breathing in, palms facing up, keeping your palms facing up, breathing out, rolling around. Start to bend your elbows down. So breathing in and breathing out. Some fantastic exercise for shoulder stabilization, and you can feel wonderful after you do this one. Good, we'll go two more. Okay, and just gently coming down and having a little rest there. Okay, take a couple of breaths. And one more breath. Okay, last little exercise at the front there, so we'll come back up. This time, I'm gonna get you to bring your hands up to that crucifix position, and we're gonna do what's called hug a tree. And here, it's just like you're bringing your hands around a big tree. And I often ask the question, when's the last time you've hugged a tree? They give us life, trees, they give us oxygen. So it can always be a good idea to go and hug one of your favorite trees and give them a little bit of love back. Good, one more. It's quite a strong exercise through your pecs. Good, and then coming back down there. And that's a wrap, guys. Thanks for watching the class. That's a nice entry-level class, level 1 class with an overall extension bias. So you can feel free to do the class a few times just to familiarize yourself with the exercises. Thanks a lot.